Hello, and welcome to the Transform Wellness Clinic. I'm Dr. Bradford Perkins, and today I'm here to talk about my Transform Metabolic Weight Management Program. Beyond the Scale, Restoring Metabolic Health for Life. So, the common complaints I hear when patients come to see me are the following. Poor advice. They see their primary care doctor, they're just told to eat less or exercise more. Not very helpful if you're not giving, all the advice. Why can't I just lose weight like other people? It feels like no matter what I do, I just can't get the results. And finally, I'm so frustrated. I've tried everything, but nothing seems to work. Here's a little about me. I was born and raised here in San Jose. I've worked in Los Gatos since 2007. I founded Transform Wellness Clinic in January of 23. I'm board certified family physician and a board certified obesity medicine specialist, and I'm a fellow in anti-aging medicine. My mission statement is to provide personalized care that addresses the core drivers of health, enabling patients to optimize their health span and well-being through evidence-based solutions and sustainable life changes. And why is this so important to me? Because, this is something I have struggled with personally. So this is my story. This is me in residency. You can see, I had hair, but other than that, I was very overweight, and truthfully, I was obese. It was residency, eating very poor, didn't move, and, just all the stress led to a lot of weight gain. And I just didn't know what to do. And that's where I delved into changing my nutrition and starting to move more. And I was very specific on what I did. Here's me probably 3 years later. I'm doing a triathlon down in Pacific Grove. And, I've stayed fit since then because, exercise has really helped me maintain weight loss. It's not great for weight loss, which we'll talk about in the program, but it's good to help maintain weight loss. I've had my struggles. I've had some yo-yoing. I will be honest. I struggle with food cravings, especially sweets. But in the program, and I've learned ways to help deal with that, either supplements or specific ways to eat. And that's the way I want to help people understand how to do that as well. But why are we talking about this? Main thing we're talking about this is because having overweight or obesity, having excess adipose tissue, which is our fat cells, increases insulin resistance, leads to diabetes. So in 2021, 50% of Americans are either diabetic or pre-diabetic. So you have 38 million people that are diabetic, probably around 8 to 9 million that are undiagnosed, and 97 million people are pre-diabetic. And overweight and obesity, you can see in 2018, 31% of people in the country are overweight, 42% are obese. So if you do the math real quick, that's about 65% of Americans. I know that's a lot higher now. And they think by 2050, 80% of adults and 60% of adolescents are expected to be overweight or obese. This is why we're talking about it, because this leads to chronic disease. This is what leads to diabetes. This is what leads to heart disease, cancer, strokes, heart attacks, really affecting our long-term health and health span. And also by 2050, 33% of the population is expected to be diabetic. That's up from previously at 11%. So they think diabetes is going to go up over 20% in the next 20 years. Obesity, diabetes, obesity itself is linked to 236 different diseases. And there is just some here. Diabetes is linked to kidney disease, kidney stones, high blood pressure, high cholesterol, cardiovascular disease, cirrhosis, fatty liver, PCOS, low testosterone, thyroid dysfunction, dementia, muscle loss, which is sarcopenia. It's also the second most common cause of preventable cancer. So number one is smoking. Number two is obesity, because it is linked to esophageal cancer, liver, gallbladder, stomach, pancreas, advanced prostate cancer, endometrial cancer, and then the ones in bold are the ones we always are most worried about: colon cancer, postmenopausal breast cancer, and ovarian cancer. So why do we weigh what we weigh? Why are some people on the thinner side while some people carry more weight? Well, it's a very complex system. It leads to, do we have insulin resistance? Do we have some kind of immune gut brain balance issue? Is there chronic inflammation? Is there a nutrient deficiency? Do we have an infection like mold from moldy buildings? Diet intake, high in processed sugar and carbs, mitochondrial dysfunction. Mitochondria is that power plant in our cell. We would dive a lot more into that in the program. Is it from stress? High cortisol, not sleeping, having an abnormal craving reward system, your thyroid underperforming, poor detoxification. That's how our body processes toxins and hormones in our body. Any drug use, genetics do play a small role. And then just what kills our metabolism? Why do some people just struggle with losing weight? And at least, poor dietary choices again. But the three hidden ones are going to be chronic stress, which is cortisol, your gut microbiome, LPS. LPS is an endotoxin that leads to inflammation, and metabolic inflammation. So if you look at it, there's a list there, but the three most common causes of why someone just can't lose weight: they're plateaued, they're not losing weight, being on the right diet is going to be either from cortisol, LPS, gut microbiome issues, or metabolic inflammation. So what is the goal of weight loss? Is it just to lose weight? No, it is to improve health. And if you see the percentage of weight loss someone needs to make to improve different parameters, it's not that much. Sure, it'd be great to lose 20, 30% of our weight, but to improve health, 5 to 10% in general will help. Now, if someone has diabetes, truthfully, it's more like 20%. If you have sleep apnea, it's probably more 15 to 20%. Fatty liver is probably more around 10 to 15%. But in general, if you're looking at reducing risk of diabetes later, lowering blood pressure, somewhere between 5 to 10% for most people. So here at Transform Wellness, we have three pillars. We have the discover phase, which is testing. Transform is to help make those lifestyle changes. And then thrive is how to go forward and maintain. So the three main causes of weight loss resistance, again, I wanted to really reiterate: inflammation, hormones, and unhealthy gut environment. So we focus on nutrition, movement, sleep, stress management, and detox, getting the toxins out of our body. So what's included in the program? You get a 60-minute initial consultation, 30-minute follow-ups that are monthly, 6-month curriculum. I do take insurance, so if you have a PPO or Medicare, there is $500 off your program. We include body composition testing, 3D body scanning. That allows us to see how you're transforming your body through the program. And we do start with some resting metabolic rate testing so we see what your metabolism is. I also add in-depth testing, because initially I didn't do these testing, but I'm finding so many people that are getting blocked on their weight loss journey, and I've decided to incorporate this into the program. So we're going to do comprehensive lab tests, and some of these you've probably never heard of, like adiponectin, leptin level. We check an insulin, we check a few different micronutrients. And then as well, through a company called Vibrant Wellness here in Santa Clara, we do some functional medicine testing, looking at your gut health, which is a gut zoomer, toxin burden, and a food sensitivity panel. I find doing these testings really help get a better picture on how to help somebody. There are some add-on testings that we do. We can do a Dutch test. That's a dried urine test for sex hormones, especially good for perimenopause and menopause women, or women having symptoms of estrogen dominance. There is a role for it in men as well. 3x4 genetics is an overall good genetic profile. And we do have semaglutide injections in the office if that is something that someone needs. Of course, we always try to get the medicine approved by the insurance, but for those where it's denied, I do offer the semaglutide injections. So here's my question. Imagine it's 1 year from today. You're reflecting on your past year and feel proud of your progress in weight loss and health. What has to happen for you to feel happy with your success? That's your main question. That's what you would want to get out of a program like this. So you have two choices. One is just continue on the same path, try Weight Watchers again, join a gym. But there's a reason why these ways of doing things don't work. They're hard to maintain. This program really lets you dive into how you can transform yourself, heal your body so you can keep the weight off, and so that you don't have to maintain medication necessarily the rest of your life if that's not your goal. The medication, semaglutide, there's tirzepatide, which is also called Zepbound. They are a tool in weight loss, but you need to make all the other changes so that it's really an overall health transformation. So now is the time. We can have great success, lead to some good weight loss and improvement in numbers, let you get out there and really enjoy the world and not have those aches and pains that you may be experiencing. Schedule now, give the office a call, and we can talk about how I could help you. And I'd love to see you soon.